I'm going to do the assessment of the chest and the lungs, of course. And, of course, the first thing we're going to do in any assessment is going to be inspection. I'm looking all over his body, looking, making sure there's no lesions. Of course, there's no lesions. His skin's intact. Just looking at the rise and fall of the chest, making sure it's symmetrical on both sides or whatever. Looks like it's pretty symmetrical. It's lined up. So I'm going to start listening to his lung fills. I like to start above the clavicle, of course, to listen to the upper lung fills. I will listen to one side, but if this was a real examination, of course, I would listen to both sides. But just for time's sake, we're going to listen to one side. And then I'll ask the patient to turn to the back, and we'll listen to the side from the back. And then we'll do our percussion on the back as well. And of course his lungs were clear. Didn't hear any wheezes, any rhonchi, any rails. The lung sounds weren't diminished or anything like that. Everything was clear. And so, of course, I would repeat it on the other side. And then I'm going to turn my patient onto the back. And I'll do the same thing, listening to his lung sounds from the posterior aspect. And his lungs were clear. Did you experience any pain?
No.
On deep breathing? Good. There was no pain. So I know that his lungs are clear on both sides because we've assessed both sides of the lungs, anteriorly and posteriorly, and they are clear. Then I'll go ahead and I'll start percussing just to percuss the lung fills. Then I'll ask him to take a deep breath and hold it, and I'll percuss again. Deep breath and hold it. You can release, and you can hear the resonance as we percuss. And of course, we would do that on both sides. This time I'm going to ask you to take a breathe in and then exhale and empty your lungs all the way out, and I'll percuss again. And of course, you can still hear the resonance. We palpate the chest, and we want to make sure that there's symmetry. And of course, there is symmetry when we palpate his chest. His lungs are clear. Now we'll go ahead and listen to his heart rate. And so I heard about 36 for 30 seconds. So, of course, that would be 72 pulse, which we know that 60 to 100 is normal. And on his respiratory rate, we're looking for a resting rate of 12 to 20. And, of course, his is 18. So his respirations are normal, and so is the sound of his chest. That is the assessment of the heart and lungs. We will look for jugular vein distension. And, of course, there is none. That concludes our assessment.